Hello, welcome to my channel. Today we're going to talk about some 3 pharmacology medications that you need to know. Let's jump right into it. So the first one is lithium. Lithium has been on every single board certification that I have taken, from the LPN to RN, NP, PMHMP. The boards love lithium. It has a super narrow range and it's used for bipolar. So it's a psych medication it's used for bipolar. Super narrow range, 0.6 to 1.2. Toxicity is above 1.5. And you need to know the toxicity levels, which is tremor, diarrhea, confusion, ataxia. So a lot of times you need to stop the medication if you take a blood lithium level and the patient is having symptoms. So depending on the questions, you monitor, you don't increase, you don't decrease, but you're monitoring for that toxic level. Also, maintaining a normal sodium level as well as hydration. If you're getting a question about someone being super, dehydrated and they're taking lithium, that should be, something that you should really think about, because lithium impacts the salt and water. Salt and water impacts lithium levels within the body. Okay, let's jump right into digoxin. So dig has also been on all the board certification that I've taken, including the psychiatric one. But the psychiatric one, Psych NP, they wanted you to make sure that you knew the difference. So it wasn't like a psych question. It was like, hey, you should maybe know this one. So it's used for heart failure and arterial fibrillation, so AFib. And also, you need to know that you need to check pulses with this medication. Hold if the heart rate is under 60, because you don't want to bottom out your patient. And toxicity level, if you're seeing the patient has yellow vision, halo, bradycardia, weakness, low potassium can increase the toxicity level of lithium. An antidote to that, not lithium, I'm sorry, digoxin. So just make sure you know that specific drug. Okay, so let's just talk about insulin. So insulin is primarily used when you're talking about our patients that have diabetes, and it's super high yield because insulin questions are everywhere on the NCLEX, from the onset to peak to duration to the mixing, and then hypoglycemia, knowing the difference between hyper and hypoglycemia. So most tested things are the rapid. So the Lispro, that's the one that you give with meals, and onset is super fast, 15 minutes. And your regular insulin onset is usually peaks at about 30 to 60 minutes, and that's only the IV insulin. The NPH is about 1 to 2 hours. You have cloudy, and it can be, key points is that it could be cloudy as well. And then you have your long acting, which is not peaking, and it's something you just really need to look out for. And mixing rule, clear before cloudy, make sure you know that. And then your hypoglycemia, knowing that, if you see someone is cool and clammy, give them candy or put something under their tongue, or, that type of stuff. So it's very important to know your insulin levels. We're going to be going into warfarin. So extremely common for anticoagulant questions. So bleeding, precautions, INR monitoring, antidote for warfarin, food integration. So, make sure you're watching out for vitamin K foods so that you can, eliminate those within your diet, and teaching about bleeding precautions too. If someone is on warfarin, what are they things to avoid? Brushing their teeth too hard, soft bristle toothbrushes, watching for bleeding, and consistent vitamin K intake. Don't go in or don't overdo it with the vitamin K, and try to avoid falling too much. And so a good memory trick for warfarin, called war with bleeding. So thinking of war, you think of blood, gore, um, and you really think about bleeding too. So hopefully that's not too corny for you guys. Next, we're going to talk about Lasix furosemide. It's super high yield. A lot of patients are on Lasix. It's used for CHF, pneumonia, pulmonary edema, excuse me, not pneumonia, and then hypertension. So, things that have major side effects of that is the hypokalemia. So, major side effects of Lasix is hypokalemia because you have excess fluid um, elimination. So, if your patient has lots of edema and you're giving them Lasix, then they're flushing everything out. So sometimes you might think about giving them vitamin K. So watch out for muscle cramps, weakness, um, and also monitor for potassium. That's what I was thinking. Monitor potassium level, daily weights with Lasix. Make sure you're doing your daily weights, strict intake and output, and monitor in the morning, first thing in the morning. And Lasix lasts all day in the bathroom is a really, really good mnemonic to really think about. So, NCLEX pharmacology success tips. So, no drug classes, what they end in, like LOL, PRILs, memorize antidotes. That's like a easy questions. Focus on patient teaching, recognize toxicity signs, and prioritize safety. Do a ton of practice questions. If you're taking the NCLEX, you need to be doing at least 80 practice questions every single day minimum. I hope this helps. Bye.